All right, how are we doing, everyone? Good. Excellent. I feel like it would not be my luck at Tom Bush if we didn't have some technical difficulties, so you're welcome, everyone. My name is Steven, and I'm from Health Designs, where the company comes in, does your biometrics, a bunch of these different workshops and stuff. I did the fitness one with you guys. This is going to be a little bit different. So, and even though this is geared towards men's health, this is also good for the ladies here too, because I know that you guys interact with guys during work, family, everything, and this is good information that you can impart along the way too. So, before we get started, what we're going to be covering today is our preventative care for, I'm going to turn this a little bit, is preventative care for men, heart health, heart disease and stroke, prostate disease, testicular disease, erectile dysfunction, and sexually transmitted diseases, or STDs. So, before we get started, I do want to make sure that everyone is pretty comfortable, and so we will be talking about some things that cause like a little bit of giggling or some blushing, but I didn't want that to kind of sneak up on you a little bit. So,
Watch out
this
for
is
Dan. Dan's going to be that guy.
Oh, gotcha.
Wow, singled out like that.
Well, and luckily with these topics, we're not going to be talking about your results, behaviors, mindset, or beliefs over here too. So, but excellent. Go ahead and jump in. So for preventative care for men, the number one thing is to, see, you're better with the positioning
I got you.
than I am. So the number one thing is to make positive lifestyle changes. This is going to be not just trying to live a healthy lifestyle, but if there's something that you've been wanting to change a little bit, if there's that goal that you want to pursue or that little pivot that you want to make, making sure that we're able to actually do that and get that integrated into our lives. This is everything from nutrition to diet, exercise, quitting smoking, drinking, any of those things. So this is where all of that plays in. So as well as getting our regular checkups with your physician. I am 100% guilty of this as well. How many guys actually have issues making these appointments? I'll go ahead and raise my hands first. So it's not something that we like to acknowledge as men, and it's something that we really need to be a little bit more mindful of. A lot of times we don't want to go to the doctor until we absolutely have to go to the doctor, or we don't want to take that trip to the specialist. But these are the types of screenings and procedures that really make sure we don't have something bad happen in the future. So it's very important that we do these preventative steps to make sure that we don't have that, oh, well, it started off as a sore throat, and then all of a sudden you're in the hospital. So as far as your annual checkups and preventive screenings for your doctors, we do have cholesterol screenings are men age 45 or higher, or age 20 to 45 if at risk. At risk means that you've either identified to or been identified to have some sort of a predisposition, or you have a family history of one of these events too. Colorectal cancer screening, ages 50 to 75. The colonoscopy for fecal occult blood test, or sigmoidoscopy. HIV and other sexually transmitted infection screening as indicated by history and or symptoms. That's on a person-to-person basis and something for you to work out with your doctor or specialist. And lung cancer screenings begin at age 55 through 80. If you are a smoker, this does actually put you at a higher risk, so it is advised that you do that earlier on in life also. And prostate cancer and skin cancer screenings are to be discussed with your doctor, because this is also something that you can have a family history that will cause you to be a little bit more predisposed to these things as well. Checking your blood pressure is something we always want to be very mindful of, and this does not just mean the once a year whenever you're having your wellness screening done, or whenever you go to the doctor's office. But I always recommend people, whenever they go to Target, CVS, Walmart, any of those places where they have that cuff, just check it and see how you're feeling. So if you're a little bit stressed out that day and it's a little bit higher, that could be a little bit of a red flag to say, all right, maybe we should do this once a week or see how this is going. You can also keep a log either on your phone or in a little book as well. That'll give you a pretty good indicator of where you're at. Make sure to note in there, have you had caffeine that day? Did you have a good amount of sleep? Were there children screaming in aisle 4? Were your kids acting up and actually the ones screaming in aisle 4? Because that's the only scenario.
Was Dan.
Yeah. Was Dan present? And so all of these things can raise your blood pressure a little bit. And then controlling your weight also. And so your weight plays a lot more into your health than what we're actually realizing. It's, you think it's just you're a little bit heavier, but depending on where you carry that weight, and guys are actually more prone to carry it around your waistline, is the more dangerous area for it as well too. So as far as our heart health, we do have all of our different tips on here as far as how to improve your overall heart health. And one of the big ones that I want to touch on is going to be, again, going along with the blood pressure, our stress levels. So as guys, you also have a little bit more of that, some people call it tough guys, no pun intended, that you're supposed to kind of keep, where you are supposed to keep, a little bit more of a straight face or not talk about, your feelings, what's stressing you, stuff like that. But if you don't have someone that you can actually have that kind of outlet with, or that person that you can vent to, you're keeping all this bottled up inside, and you're actually going to cause your blood pressure to rise. It causes you to retain fat in different ways. It causes your cortisol levels to go up. And there's so many different negative factors that are impacted with that. Whereas if you were to just take about 15 minutes of bleh out with your friend or your close family member, someone at work, anything, it really pays off in the end. So sometimes letting down those walls a little bit and letting out some of that stress through a healthy mechanism, not smoking, drinking, any of that kind of stuff. Working out is some people's stress reliever. It really has a bigger impact and is beneficial to you and your overall health.
And on that note, during our enrollment, we'll talk about it. We'll have a new product this year, similar to telemedicine, but more focused on mental health. So it's a free resource where you can call and you can burn it all out. You don't have to give it something that you might not feel comfortable with. So.
Mm-hmm. So that's one of the things that's frequently overlooked is the just benefits of having that person that you can vent to, that you can talk with, and everything. And it's something that culturally we're moving a little bit more away from, and it is a definitely positive change too. So aside from that, we do have the usual suspects on here of quitting smoking, controlling your diabetes, if that is an issue for you, getting active, eating healthier, achieving a healthy weight, managing that stress, and doing healthy routines. If you can make a routine out of a lot of these things, it becomes so much easier to do. How many people have heard about that whole, it takes 21 days to set up a habit? Show of hands. So that's where this more plays in a little bit. If you can do something for 21 days, it proves to you how simple it is and how easily it fits into your life. And it's a lot easier for us to make these changes and also never overlook the benefits of a short or a small 1 degree change. So when we're talking about changes, we're not saying to overhaul your entire life. We're saying just change one tiny little thing. And if you shift 1 degree, at first it's going to seem so small, but the payoff at the end, as you keep going over time, ends up being a huge night and day difference. So it doesn't have to be a total overhaul of everything. And actually, the less we take on, the better chance of success that we're going to have. So heart attack warning signs, other than how beautiful this picture is, that is a little heart attack inducing, we do have acute chest pain, chest discomfort, discomfort in other areas of the upper body, shortness of breath, and dizziness or sweating. How many people, if you had one or more of these symptoms, would just automatically think, uh-oh, I should probably go to the doctor? So not many of us. And this is where we need to be in tune with our bodies and more open-minded to actually going to the doctor. Because I know if I started to get a little bit of chest discomfort, especially if it was after working chest at the gym the day before, I might just kind of glaze over this. But really, if you have any one or more, even more so it's more, of these symptoms, is when you need to at least be letting someone else know or contemplating, what could this mean to me and my health? So, because the worst thing that could happen, you end up making a trip to the hospital and being told that nothing's wrong, other than potentially dying. And so, or the complications that'll come along with that heart attack later. So also, we do have the family history too. If you are at risk via your genetics, if you had any kind of a close family member in your direct lineage who has had a heart attack, you are automatically more predisposed to it. So and you're at higher risk for that. So especially if you have any of that, you need to be in particular in tune with the different parts of your body and how that feels. Stroke warning signs. So a stroke is actually, in my opinion, one of the most terrifying things that can happen because it can happen so quickly and you don't even notice. With stroke, one of the things that we need to remember is act fast. F is for face drooping, A is for arm weakness, S is for difficulty speaking, T is for time to call 911. If any of these things happen where you see that face drooping on either one side or both, that arm weakness, how everyone says, kind of you go numb in your left arm or anything, that's when we need to act quickly because a stroke can actually cause an entire body shutdown. It comes in many different forms. And if you can get to the hospital in time, that can be prevented. Otherwise, it doesn't always kill, and then you're left severely disabled, which is so much better just to go ahead and prevent in the first place. Know all the different warning signs, and then trouble seeing off one or both eyes, sudden confusion or trouble speaking. This occurs in the brain, so it's not touch on side, is it? No. So anything involving your neurological functioning is a good indicator that you could have something severely wrong and to get to the doctor immediately. So heart attack and stroke risk factors. Again, the usual suspects. We do have on here Life Simple 7, which are the top 7 bullet points over there. As well, we added on high stress and family history of cardiovascular disease on here. Even though he's having fun, it will not last long. So do keep that in mind too. Any of these things, one of the terms that we like to use is comorbidities like to hang out together. So once you are diagnosed with any kind of a health condition, whether it be diabetes, hypertension, any of these things, you're automatically predisposed for the others. So these are all comorbidities, and they like to hang out together, meaning they want to hang out with their friends. So they're going to push you a little bit harder to get the other ones going. In addition to this, obesity or poor nutrition leads to many of these things as well. So we want to make sure that we're trying to prevent some of these things from setting in the first place, and then it leads to a happier, healthier, and longer lasting you for both your friends, your family, and yourself. All right, this is where it's going to start to get a little different. So prostate cancer. 1 in 6 will be diagnosed with prostate cancer at some point in their lives, but only 1 in 35 will die from it. Prostate cancer is a very treatable type of cancer. So with this, you also, again, have a high predisposition based off of your family's genetics. Even though it is recommended that you should begin prostate cancer screenings via either PSA, which is your prostate-specific antigen, or I believe these are on the next, nope. Okay, either a prostate-specific antigen or the DRE at 50 or higher. If you have had a family history, it is more important for you to be screened more often. That's something that you and your doctor can set up as well. And so with these, just because you have a positive result from a DRE or PSA does not mean that you positively have cancer. That's for your doctor to diagnose later on as well. And so, and sometimes different doctors will actually recommend that you begin prostate screenings as early as your 20s, depending on the family history, how much of predisposition you have. So some important things to note also are that age, as I said, increases after age 50. Race, it is actually more common in African American men, a family history, and diet. So there's 2 different things that have been seen in diet. High red meat consumption or high dairy consumption, which is also linked typically with low fruit and vegetable consumption, has actually caused or been shown to have a higher risk. They're not sure which side of that it is, if it's the red meat and dairy or if it's the low fruit and vegetables. It's just because people who typically do one do the other. But that has been shown to actually have a negative correlation. So as far as signs and symptoms, if you're ever having trouble or keeping an erection, blood in the urine, pain in the spine, hips, ribs, or other bones, weakness or numbness of the legs or feet, or loss of bladder or bowel control, could be warning signs to go and get checked by your doctor immediately. Again, that's when they will do either the PSA or DRE, or both. But it's up to them to do a biopsy or other screenings to actually determine the diagnosis for the prostate cancer and steps to move forward from there. And this goes into a little bit more of the ages, as well as PSA, prostate-specific antigen, is a blood test, and DRE is the digital rectal exam, which I don't feel like I need to dive much deeper into that one. And the ages in which to check for that. So I'll let you guys read that for a second. All right, so moving on to testicular cancer. This is not one of the more talked about or prevalent forms of cancer for men. However, this does occur in 1 in 300 during their lifetime. It can be either one or both of your testicles. It is important to note that with this, even though you are to be checking for lumps or a size difference, that is innately happens where the testicles are not the same size nor the same level. And this is something that should be brought to your physician's attention promptly too, as any kind of cancer can spread to other parts of the body as well. For this, we do want to make sure that we're looking for any kind of pain or swelling of the lower abdomen or of the testicles themselves. And this is something that you can check with yourself also. Benign prostate hyperplasia. So this is not necessarily cancerous or prostate cancer. This is actually a swelling of the prostate itself. This can cause some blockage of the urethra, which causes the weakness or slow urinary stream, a feeling of complete bladder emptying, difficulty standing or starting urination, any of those other symptoms up there as well. With this, it typically happens later in life, and it's not necessarily always something we have to treat, depending on what the diagnosis as far as its cause is. Erectile dysfunction. I told you guys this was going to get in depth. So erectile dysfunction, this is not an actual, or it's not considered normal at any age to have this issue. So even though this is frequently later in life, there's some sort of an underlying cause that's actually making this happen. So it can be anything from atherosclerosis, which is the hardening of the arteries, nerve disease, diabetes actually impacting it, heart disease impacting it, anything that's causing a reduction in bloodstream or the messages being able to be sent through your body can cause that. And it is something that should be brought to your doctor's attention as well, so that you can figure out what the cause of this is. And last but not least, sexually transmitted diseases. Even though this is something that's talked about a lot for more of like the middle school, high school, college age group, this is something where it is always prevalent throughout our lives. The highest rate of STD contraction in the state of Florida is the Villages, which is a retirement community. And so, if that gives you any kind of an indicator, this is something where certain STDs can go, as we all know, unnoticed, like kind of you don't have any kind of symptoms or anything that's going on, but it is still important to be checked. With this, certain ones, of course, do take a while to actually show up or to have symptoms. Some never cause symptoms until they've already been contracted to multiple people. This is where things like the Villages actually gets a little bit more its reputation, where people are saying, oh, who cares, or else they just did not have this education previously, but it's something that we're seeing a huge rise in nowadays also. So, with that, any questions? I know we did just unpack a lot of information in here. And so do we have any questions or anything for the floor? Also, if it's any kind of a private question, I'll be available for afterward too, because I can understand why some of these things might not want to be blurted out in front of other people. Anyone? No?
Ladies, any questions?
Lots.
We're not doing...
I got a fun story, it's not so many questions.
All right, then here's, of course, all of our references and everything as far as the different places where we got a lot of the information through. And I don't know how to stop the
Nice.
recording.
All right.
All right.
Appreciate it.